Hello and welcome to the True Man podcast, the podcast designed to create a generation of self-defined men. Today, I'm joined by Michael Strøm, aka the penis guy, aka the sex health expert. Michael, it's an absolute pleasure. How are you doing?
I'm very well. Thank you for having me on the podcast, and you're touching in on a really important subject in these times.
I'm looking forward to it. It's a bit of a different sort of angle from the podcast normally, but I think it's really important to have these conversations. We've obviously spoken before and said that these conversations rarely do happen. So I am excited to have this conversation today. But first, and as always, Michael, in your own words, what makes you a man?
What makes me a man is that I'm staying true to myself, and I don't give a fuck about what other people think. And I know it's like a toxic masculinity statement, but today we're trying to fit in everywhere. And for instance, today I'm wearing pink. Lots of people say, oh, if you're wearing pink, that is a gay color. For me, it's like being self-confident, resting in myself, my sexuality, and who I am. To say that I don't care what color it is. I can wear this because I stay true to myself. So for me, being a real man is being strong, independent, but also being able to be sensitive, having emotions, and find the balance in that, especially when we have a society that's very driven by social media, having to look perfect all the time. I'm not a perfect guy. I'm having flaws as well, and I'm not striving to be perfect because that would not be fun. So that is what being a real man is for me.
I love that answer, and that is a lovely waistcoat and trouser combo. I'm very jealous. Uh, your profiles online have lots of images with very similar in different color sort of style. So you're very true to your word when you say that for sure. Can you maybe just explain a little bit why you call yourself the penis guy?
Yeah, it's for many years I've been working within the men's health field, working with shockwave for erectile dysfunction, Peyronie disease, pelvic pain, and you need to stand out because it's a very difficult topic to talk about. During last year, the penis guy just started coming up when I was talking with people. They asked for what I was doing. I said I work with men's health, I work with erectile dysfunction, and then I was just in the end, hey, I'm the penis guy. I'm the guy you need to have in your network. I work with the penis. So it's becoming like it was a fun thing. Now it's a quite serious thing to work with a delicate area. So I'm the penis guy. I see dicks all the day. That is what I do. I'm heterosexual. I'm not gay, and I don't care about the sexuality. But for me, I just work with the penis, and we need to have someone that dare to say it out loud.
What is erectile dysfunction?
Erectile dysfunction is a medical condition, but also a psychosexual problem where and that is a problem with the definition, and I'm sure we can go into that, but it's the ability to achieve and maintain a satisfactory erection to complete intercourse. So the word satisfactory is that for some men, if we use a score that's called the International Index of Erectile Function, it goes from 8 to 25. Basically, people that has a 24, almost perfect function can say, I have ED because I can't perform as I was 18. So it can be a medical condition. It can also be a mental part. I see more and more young guys coming into the clinic in the 20s having erectile dysfunction because of performance anxiety, even though there's no medical issues.
Why do you think it is getting younger? Why do you think performance anxiety is starting to creep in to this space?
I think a big part of the answer is due to social media and the culture we have today around it. You need to look perfect. You need to look sharp every day. You need to be strong. You need to look good. You need to be a perfect boyfriend, husband. You need to be perfect at work. Everything needs to be perfect. And then they meet these females or guys and they start to doubt, do I have the value to maintain this person? Can I keep the interest? So if I can't perform sexual wise, why should that person have interest in me? Because everyone is looking at sexuality. And one of the other things that's important to discuss is the use of porn. So when people are using porn online to have the references for sexuality, then they'll always see very strong erections, long intercourse, big, powerful ejaculation. And that is not how it is. But people think that because we don't talk about it anymore. even yesterday in Denmark, it came to public that when you reach 7th grade, then you're about 13 years. Half of the students is not going to the shower after gym classes because they're afraid of being bullied by how they look. So we are starting to have more and more taboo about sexuality and the body. And if we don't get exposed to different body types, different kind of people, how will we ever be able to perform in a sexual content? Because we don't have the language or the experience about what is normal.
Do you think that's sort of a balance between overexposure? So, like you say, you see penises every day. Do you feel like we as men, we see more penises than we maybe were used to seeing, and like in a few years ago, or even maybe ancestrally? Like, does that genuinely have an effect on your mindset towards your own penis?
I think the biggest problem is that we have the social media. The porn is one thing, but it's the expectations, it's all the filters, it's all the guys standing there looking really, really strong, no matter how old they are. It's a focus on testosterone that we need to have a high level all the time to perform. So if we just have a more normal growing up without the social media, remember Denmark in the 70s released the porn. We set it free. Now we are getting quite uptight. We're almost getting British. And that is the issue, that we don't talk about it anymore. And that is impacting the way of being a man today. The same with the Me Too wave. And it was very important that we set focus on these unacceptable behaviors in the society. But that is also limiting a lot of guys in staying true to themselves. Can they flirt? Can they reach out? Can they put their hand on the thigh? How do they approach a woman today? That is making them insecure. So it's a combination of a lot of things right now. So it's not a simple answer, and that's also why it's good we have talks like these where we can get different perspectives.
Yeah, I sort of sit with you on the same front when it comes to the rise of feminism and sort of what that means for men and boys. And essentially there hasn't been a conversation, right, of like what that actually means for a man or for a boy. And like you say, these sort of traditional roles that were in place have morphed and changed, and that has created confusion in mating. Like, what is the right cues? What are the right things that I do? What are the things that I can say? Like you say, where can I touch? When can I touch? Like, do I have to ask for consent? Is it got to be that robotic? That seems to be what has been sort of portrayed in the media. And at the end of the day, there is an animalistic sort of urge from both parties, right? And sometimes you can just sort of read a room, and it's, I think teaching guys that is probably a big conversation that is not happening, and that, like you say, feeds into performance anxiety and just anxiety in general. One thing I am interested in, and one thing that maybe we should just touch on first, is probably, I guess, the more medical definition of ED and erectile dysfunction. So we're obviously talking about performance anxiety, but what are some of the sort of symptoms or things that lead to a medical sort of actual effect of
The
erectile dysfunction?
the most important thing is to know from a medical perspective, from a physical perspective, potential erectile dysfunction can be the predecessor of severe cardiovascular disease 5 to 10 years down the range. So that's why it's very important that if you as a guy and a viewer of this recording is experiencing ED and you're in the 40s and you have sedentary lifestyle, you definitely need to go to the doctor, because obesity, smoking, alcohol, inactivity, stress, that can lead to a majority of different cardiovascular diseases. It can be diabetes that is severely damaging for the body. It will downregulate your testosterone. It will degenerate your nerve endings, your blood vessels, so you will have lower function in general. If you have atherosclerosis, that can also lead to ED. So it's very important to take it seriously when you start to experience it, no matter the age. In general, above 40, a lot of the guys will have some more cardiovascular disease. Below 40, more prominent with the psychogenic issues. Of course, if you have radical prostatectomy, prostate cancer, cancer in general around the pelvic floor, that can lead to ED. We can work with that afterwards with the proper rehabilitation. But it's important to take it serious. The more medication you take, the higher risk you're going to have for having the disease. One of the things that's also a big thing in young guys right now is the medication finasteride to prevent hair loss. It's also used to keep prostate enlarging under control. That can, in rare cases, give ED as well. So in general, if you stay healthy and fit, have a good amount of physical activities, healthy nutrition, you get your sleep, you should sleep between 7 or 8 hours every night with high quality, then you're going to keep a good function. So when people come to me, they sometimes expect miracles with the shockwave that can increase blood vessel formation, increase the circulation, more nerve activity. They don't want to look into what is the actual root of the problem. Maybe I should start moving more. In Denmark, we just crossed 50% of men and women with obesity. We have severe obesity for about 25%. In US, we have more than 50% of severe obese people. In UK, we're starting to see the same. So with the society we're in right now, getting more and more unhealthy due to processed food, inactivity, then we're going to see more of these cases. It's going to lead to a downwarding spiral with the psychogenic part, where you're going to have the performance anxiety because you're going to fail once, and then you automatically will catastrophize it, say, oh, I did it once, now I'm going to fail again. So you also see these combinations. So it's not just the medical, it's a combination of several factors weighing in. And we also need to look at the testosterone that is dropping in general from the age of 30, but also because we don't work out in the gym or use our body as our ancestors did. We are not working in the fields anymore. We are sitting in a very nice office, doing our thing, and just getting more and more lazy. So that is some of the things you need to be aware of.
You mentioned medication in that sort of statement there. And one thing that I find interesting, and one of the conversations that we sort of had before was with performance anxiety, especially in younger men, there's a sort of maybe a lean towards a little magic blue pill and maybe taking some Viagra. I think I mentioned that a friend of mine was struggling during university and started taking a lot of Viagra to sort of get them through university. What are the negatives for ignoring that and trying to sort of, I guess, self-medicate?
I think the most, let me take it another way. I got an email from a potential or from a reader from the website yesterday, and it only said, what is the best medicine for erectile dysfunction? And that is the wrong question to ask. The right question is to ask, how can I improve my sexual function without medication? So most people go to the blue pill in a way to ignore the causes of the problem. So you can do it for a while, especially when you're older, but at some point, maybe the blue pill won't be working anymore. You will have less function. And that is because your cardiovascular system is not working properly. But the other thing is that if you have more psychogenic mental performance anxiety, then the blue pill can act as a placebo for getting a bit more function. It can be like having training wheels on when you're learning how to bike. But what people forget about the blue pill is that you still need to have the desire for having the erection. Yeah, you're going to have more blood flow, but if you don't have the desire or you want to have intercourse or sexual activity, the pill won't work. So a lot of people think that if I just take the pill, everything would be good, but you actually still need to have the brain sending the signals to the penis in order to maintain and get that erection. So you should more be looking into the cause, no matter if it's medical or more psychogenic. And one of the big things, I'm going to wrap it up now, about the performance anxiety is if they're coming from childhood with only getting acknowledged if they've been performing all the time. If they only got attention from their parents if they've been performing well. If they haven't been performing, they'll be yelled at. That is setting a very bad motion into theater. So these guys will do the Viagra to just be sure that they can perform, instead of looking into the fact, okay, who am I as a man? I'm good enough without the approvals and recognition of others. You need to be able to love yourself before you can love anyone else. So maybe that's where we're going to go instead of the blue pill as the first thing.
So if there's someone listening and they are seeing sort of early signs of erectile dysfunction, what would you sort of suggest would be the first steps for them?
The first thing is go to your GP, no matter where in the world you're sitting, get some blood works done. If that's all coming out perfectly, look into the next step. Find people like me or a urologist that can do a more thorough exam of your penis, your pelvic floor. That can also be tight pelvic floor muscle. We can have the diaphragm that's very tight, bad breathing that can affect the general system. No matter what, if you're in doubt, go to the GP. It's not a unmanly thing to do. It's okay to talk about health. We know that females is going more to the doctors in general. That's also why a lot of men end up dying by prostate cancer because they ignore the symptoms. So instead of just ignoring symptoms for your penis or other things in the body, then go to the GP, get the first test, and then you can go on from there.
What is sort of the strategy that you sort of implement from your own practice? What do you look for if bloods are fine? What's the next stages?
I look for the condition of the arteries. Are there any arteriosclerosis in the penile arteries? The arteries in the penis is only 1 millimeter in diameter, so it doesn't require a lot of plaque to build up a blockage. So we look at the tissue quality. We look at pelvic floor function. Can they actually control the pelvic floor? We look at the general lifestyle. So a typical treatment course with me would include lifestyle modifications, most likely more physical activities, reducing of alcohol, smoking. We forgot about that before. When you smoke, you do vaping, it destroys the endothelial tissue and your ability to have an erection in the long run. And then I do the shockwave and magnetic treatment to increase blood flow, to increase nerve activation. We do it over 6 to 12 weeks in general to make sure that people also maintain their lifestyle. If we're talking about testosterone, then we always get a test, do 3 months of some kind of modification of lifestyle, see how they respond. If they respond positively, we can continue on that. If there hasn't been any response, then it could be worth talking about getting a testosterone replacement therapy. So it depends from case to case. Sometimes we just need to work with the mind. Then it can take 2, 6, 10, 12 months to get that self-confidence built up. So it's very different, but we always try to do a 360 and close the circle in the treatment course.
We sort of live in a society now where a pill is prescribed to a lot of things. So I'm sort of thinking around Ozempic and Mounjaro at the moment for sort of weight loss. A lot of the things that you're saying are sort of time sensitive. There's a lot of time, effort. There's a lot of sort of personal work. Like how do you encourage men to sort of take that approach rather than the quick fix that, like you say, social media is sort of portraying in a number of other scenarios? How do you sort of undo the work that is already in play?
Normally, I try to tell people that if they've been having erectile dysfunction for 5 or 10 years, we're not going to solve the problem in 5 to 6 weeks. It will take time and it comes to, if we talk shoulder injury as well. If you've been spending 6, 7 months to build that massive injury, it's not going to take 2 or 3 weeks and then you're back into the game. So it's about putting things into perspective. So right now, guys in the 50s, I'm always trying to tell them, okay, you've been putting money into your retirement fund, right? Yeah, we have. Okay, now you need to put in physical activity on your body's retirement fund. So we need to take the long game. I'm trying to explain to them, okay, you also want to have your erectile function when you're 70 and 80. You don't want to just end it in 5 years. So take the steps now. Accept that we're going to work on this 6 to 12 months to stabilize. And it's the same with Mounjaro, Ozempic, all the GLP-1s. If you don't change the lifestyle, then 12 months after you end the treatment, you will be back at the starting point. So yeah, we can get the medication, we can get the quick fix, but then you're going to end up in a lot of quick fixes and your weight will just go like that and your function will just decline. So it's really important to try to figure out what the motivation is for the guy sitting in the clinic. And if it's because their partner has been dragging them in, 1 out of 2 will never come back after the initial consultation because they're not ready for that. Their partner is really ready, but they're not ready to commit to that change. So it's really important to say there's nothing as a quick fix. And even with pills, there can be side effects. It won't last forever. And I'm truly believing that if you work more organic, accept that it takes a bit more time, you're gonna have a higher quality of life. And it will also build on your self-esteem when you actually put down the work. The first 3 months is extremely rough when you start in the gym. It's not fun. It's horrible. But the long-term effects after that point is amazing because you're getting work done. You're actually doing something for yourself, especially in this very high-paced society. I'm taking out an hour, that is me personally, 1 hour every morning, the entire week, to go to the gym, do my weights, do my cardio. Then I go to the spa afterwards and relax. That is my investment in being able to run a high-paced clinic and have a high cognitive function. So it's really about explaining and leading by example that, yeah, it's tough, but there's nothing at a quick fix. And to close it off, when I spot people that want a quick fix in the clinic, I'm not taking them in for a full treatment course. I give them the initial evaluation, tell them this is what you can do. I don't think that my solution would be right for you. If you want to have a quick fix shockwave treatment course, these are my colleagues and they will be more than happy to help you. And I sending these clients and that income away because I know in the long run they will never be satisfied and it will just come a negative back to me, and I don't need that.
One of the things that we've spoken about is as we age, we sort of see a natural decrease in testosterone. We see maybe a natural decrease in sex drive. But the more men that I speak to, and probably the more men that you speak to in their 40s, 50s, and 60s, want to still have sex, want to have sex, are still thinking about sex. Why do you think we think as we age, we don't want to have less sex, but when we get to that age, we're still thinking about sex?
I think it's a complicated question, so let me try to keep it simple. Um, we are we're grown up with the ability to have sex to reproduce. With our parents and our ancestors, it was for reproduction. Now it's more for fun. It's also because that we have the physical needs covered. We have a good income. We have our housing. So now it's more about self-realization. What can I become? So when we get older and we reach about the 60s, most people have more time. Sexuality will change. It will not only be about penetration. But the issue is that, yes, testosterone is dropping. When it starts to drop, we don't have the same amount of desire. So then we don't have the urge to have intercourse in the same way. But if you look at people that is high performing in C-suite level, if you see people that's really hitting the gym, being active, they have a higher sex drive because they keep active. So yes, testosterone will drop when we turn 30, about 1 to 2% a year. But if you put in an effort, you work with the big muscles, you can decrease the drop in testosterone during the years. One of the guys I do my training with in one of the CrossFit classes, he is, and I'm 40, he's 72. He is a fucking beast. He is deadlifting 150. He's front squatting 100 plus. He is throwing away with the big dumbbells. This guy, he's amazing. You don't see any signs on low testosterone on him. But for the last 15 years, he's been doing workouts every day. He's keeping up his body. He is more ripped than I am. And I'm quite ripped when I'm getting out of this clothing and go to the gym. So it's also because that we don't take care of ourselves. We are accepting that every year we gain a kilo. The six pack is getting to the big one pack, and we're starting to have the BMI reaching 30, body fat percent on 35. So I think one of the reasons is also we're looking at ourselves in the mirror, getting more and more unattractive, and then we don't really want it. We start to close the lights in the bedroom. We start to draw away from physical relation. So it's also a matter of the way we live today, because we can see it. We can see we're not as we were when we were young, and that disgusts a lot of guys. They don't want to look themselves in the mirror.
Do you think the work that you do saves marriages?
For sure. I've been saving a lot of guys, and also the ones that's getting out, they're getting divorced, they find a new one, and they know that they need to nail it now, otherwise it's a no-go. So the most important thing is not to do the shockwave treatment in the next room. It's about making the guys understand what they can do instead. So when females are in the 50s, around the menopause, they don't feel, for most of the time, the need to have penetration sex. They can be stimulated in other ways, but when they come across that, penetration can be on the table again. So we also need to acknowledge that sex can change during the lifetime and a relationship. So if we can have people having more discussions about it, then it's easier. And it's the same with new relationships. I have a guy coming in tomorrow, met a new girl, and he is very anxious about the sex they're having. Is it good enough? And I asked him one question. Have you asked her what good sex is for her? And he was like, no. And that is a question I ask a lot of the clients coming in the clinic. What is good sex for you? What is good sex for your partner? And what do you want it to be? If we can just start with that small question, a lot of the performance anxiety will disappear. Because if you as a guy, if we say that you think that your wife or girlfriend wants to have penetrative sex that lasts for 1 hour, and that is your end state, that is what you think you need to do, and she actually just wants to be close, she wants to feel stimulated, she doesn't need to lay there for 60 minutes, then your view on sex is different. So she's just like, oh, come on, get done. But she's enduring it because she also thinks that, oh, this is how sex should be. So if we just start with the talk about what is good sex, what do I want, what do the other part want, and find the common grounds, then we won't have the problem.
The very first question I asked you, which was what makes you a man, you essentially said you're unapologetically you. And I think what you've just said there is basically that, right? A lot of men aren't unapologetically them. They don't have those conversations. They're scared to have those conversations, whether it's a fear of their partner leaving them, judgment, an array of other things, right? Weird that they want to talk about sex over on the couch or over dinner. Like, why are we talking about that now? This is a quote unquote bedroom activity. And I think they are important questions to be asking if you want to be with someone for a long period of time, 20, 30, 40 years plus, and have a successful relationship. It's almost stupid not to ask those questions, right?
Yeah. And I think that's the issue, because we see everything, social media, we see porn, we see we just have election written out in Denmark right now. So now we have all the election posters, all the males, very nice suits, and then we have the female candidates. Okay, they are going a bit more aggressive on the clothing, on appearance, because they know that can work. We see sex everywhere. So everything needs to be perfect, instead of just asking, what do you want? How can I make it good for you? And it doesn't make you a lesser man to say, okay, what is your desire? It doesn't make you a lesser man to say, I don't need to have ejaculations all the time. We can go into tantra as well. But it's more about just saying, right now I feel this. Another myth is also that a man is always ready for sex. I have tons of guys coming in saying that their wives or girlfriend just want them to be able to perform on the second. They just need to stand there, get a hard erection, and do them. But some of these guys are more sensitive. They need to have the closeness. They need to have the relation building up during the day. like we traditional will say is a more feminine way of having sex. So if you're a man and you know that you need some closeness, you need to feel safe, just say it instead of just like, fuck, I can't do it right now. Now she thinks I'm a failure. Just be honest about it.
We spoke about saving marriages. Do you also think like a lot of people are in incompatible relationships? Do you think once you have these conversations, or if you have these conversations early on, you're able to realize whether you are actually sexually compatible with someone? Like maybe they do want all those things, but you don't want those things. So deep down, you know that that won't move past a platonic relationship long term.
Yeah, I never tell my clients what to do in that sense. That's very important. Everything needs to be on their own and their own decision. But for sure, if you let's take an example, a female that wants to have an open relationship with multiple sexual partners after being in a marriage for 10 years, if she's starting to get bored. She wants that, and the male is starting to like, okay, is that really something I want? Maybe they will go along in the beginning because then I can keep her. But if that guy doesn't feel safe about that, doesn't really want that, maybe it's not the way to go. It's the same if you want to. I knew some people that they met in a BDSM environment, so there was a dom and a sub. In the end, they ended up being together, and the sex they had in the club was different from at home. But the roles was a bit difficult for the couple because at home the sub wanted to be more equal, and the dom wanted to be it as in the club, even though that was not the point. So it's really important to have these talks because otherwise, in the long run, it won't help. It won't work. So do it in the beginning. We start the first date with like, oh, what do you like to do? What is your leisure activity? Are you climbing? Are you knitting? Are you eating? Maybe we should also talk, okay, what is your sexual preferences? And it can be quite offensive, but if you're a true man and you stand by yourself, it's a quite important question because there's no reason to get involved in something where you know that a basic part won't work.
Yeah, I think it's extremely important. I think you need to have those conversations, and I encourage men to have those conversations. They're conversations that I've never had in the past, but have actively made an effort in my most recent relationship to have those conversations because one I want the relationship to work, and two I want to have a happy relationship that I enjoy and they enjoy also. Like I think it's extremely important. So I do completely encourage people to have those conversations and do those things. And I guess sort of on that, and also the other side of the coin that we've spoken about, which is this looking after yourself, going to the gym, eating better and sleeping better, and essentially being more selfish as a man when it comes to your own health. How do you sort of explain that to your clients, or what's your view on that when it's framed in society a lot of the time, some of the things that you're suggesting, as I guess toxic and sort of against this femininity movement, and the other things like going to the gym can be perceived as a toxic trait, which is just beyond bizarre, but it seems to be the case.
It's really a delicate subject, but for me, it's not about going to the gym to be bigger. For me, it's about being strong and being able to have the capacity. But the very important thing is that we're living in a society where we constantly are required to be something for someone else, and that goes for females as well. So this will go out to both females and men. What I'm going to say now, you need to take time for yourself. You need to be able to say, I'm going to invest 1 or 2 hours every day in myself. It can be going to the gym. It could be reading a book to do some mindfulness. This is not toxic either for feminism or masculinity. This is about taking care of yourself because if you go to work for 10, 12 hours, being something for someone else and not for yourself, you're going to burn out. And that's why I think we see so many people with stress. They don't prioritize themselves. Me, my biggest guilty pleasure is food and wine. And I drink wine several times a week for dinner. I have sometimes for lunch when I'm going out. And if I want to do that, I need to go to the gym because otherwise I'm gonna be obese. I already know that if I drink too much alcohol in the evenings, my sleep quality will be less. So it's not about being toxic, it's about being realistic that we come from a society where we're working physically 8 to 12 hours every day to now, if we're lucky, that is why we're talking about these 7 or 10,000 steps a day. That is what we get. If I didn't go to the gym, my physical activity would most likely be around 5,000 steps because I go to my car, I go into the clinic, I go in another room, and then I stay there for 5 to 7 hours just being in these 20 square meters. So it's about taking charge of your health. That is not toxic. It's just being realistic and prioritizing yourself. That should never be something that people look down at.
Yeah, I completely agree with you. I think it's something that needs to be challenged and pushed back on significantly by men, politicians, whoever's sort of wanting to on that statement. I don't think those things are negative. I think it creeps into the word testosterone as well. I think this conversation that we're having is extremely rare, extremely unlikely to happen regularly. I talk about my own sort of schooling and sex education, which was basically putting a condom on a banana,
Yeah.
ask for consent, and don't give anyone an STD. And then that was the tick box done for that. No one once mentioned testosterone, what it was, why my voice was deeper. Oh, no, that was it. My voice was deeper, and I'd start getting hair in places that I didn't have hair before. And that was the definition of testosterone for school. And you look at it from a feminist point, a feminine side as well, where menopause is only just really being an open conversation. So sort of women in their 50s and 60s are able to talk about that a little bit more open. Do you see a reduction, I guess, in prudeness towards sex and sexual health? Do you think that is changing, or is there still a lot of work to be done?
There's definitely still a lot of work to be done. We can just see it on online. If you posting with sexual health, you're gonna be banned. I had like a picture where I had two shockwave applicators pointing towards a replica of a penis, basically a dildo. There's nothing offensive about it. That was banned on LinkedIn right away. My colleagues in this field, they're getting banned on posts if it has sexual content. How did it came sexual content to display something from a medical perspective? So we have a lot of censorships online regarding raising awareness. You can sell porn, different toys on web shops, but if you want to do ads on Google, you're going to be limited because it's sexual content. So we have a lot of talks to do. And as I said, in the 70s, Denmark released porn. Now we're restricting more and more around sexuality. We need to find a balance. So there's still a lot of work to be done because it's not something you speak loud of. And that's also why I openly on my social channels is the penis guy. When I was at the European Society of Sex and Medication conference in Portugal last week, when people ask, "Hey, I'm the penis guy," and they're like, "Ah, you're joking," and I just showed the LinkedIn. This is the penis guy. Let's talk about it. That's even within the field that there can be a bit of hesitations when you speak too open about it.
I do find it quite bizarre. I've had guests on before that have we've spoken around intimacy and sort of a deconnection from porn, and they say that they also struggle with posts online. Yet if I was to go onto to Instagram now as a man in his 30s and scroll 3 or 4 times, I'm sure I would be attacked with some form of reel of some caddily dressed woman sort of peddling some form of subscription service that she offers, and it would be totally fine. So there is this sort of weird hypocrisy to this, that you can find softcore porn, but you can't learn about your penis on the same
Yeah,
platform.
and I think that in the next few years we're most likely gonna talk about the andropause, the decline in testosterone. But I think the most important thing is to discuss openly that if we take care of ourselves, if we treat our body well, we won't see the same issues. We talk about all kinds of female problems, having a period, these things, that's a public thing in the workplaces, at least in Denmark. We need to pay attention to it. No one is paying attention to the ad reports or the decline in testosterone for men. We just need to perform all the way. So I think that is something we need to raise awareness of. We need to raise awareness around prostate cancer. Get that checkup, especially when you start reaching 50. If you're starting having problems with peeing, urinating, having a weak urination, go to the GP. Make sure that there's nothing wrong. So there's a long way to go. I thought we were really on a good track until about 10 years ago, but now it's been declining, and there's a lot of work to do, and you're gonna be a big part of it with your podcast and talking about what is the true man. And we are all different, and we just need to accept that we shouldn't look the same. I don't expect everyone looking like me. You also need to have the self-confidence to pull it off. If I took this, some of my clothing, my jackets, and gave it to some of my friends, they can put it on, and so right away you can see this is not them. They won't have that attention. They don't feel comfortable wearing stuff like that. So if you want to wear a t-shirt and you feel good about that, if that's what makes you look sexy, then just do it. If you want to suit up in a pink suit, just freaking do it. You are the man you decide to be, no matter what. And in the long run, people will accept it. They will respect it. Maybe they're not going to understand it, but you shouldn't be caring about it. There's space enough for everyone. And you don't need to have everyone liking you. If you just have 5 to 10 good friends around you, that's more than enough than the 100 assholes in the perimeter that's just like bullshitting.
100%, completely agree. What in the men's space as a whole do you like at the moment, or what do you want to see a little bit more of?
I want to see a bit more realistic expectations around testosterone, because that's really been a buzzword the last 5-10 years. We're always debating, should we just do it right away, or should we try to change the lifestyle? But a lot of podcasts, books, people in the pharma industry is promoting testosterone like being the ultimate truth. But just like with the GLP-1s, when you look at the Ozempic, Mounjaro, and these different medications, it's not a wonder drug. You still need to put in the effort. So I think we need to have more realistic expectations about testosterone replacement therapy. I've been having guys with prostate cancer surgery coming in and telling me that my treatment is not the right thing for them. They just need testosterone. Where we have nerve damage, we have damage to the arteries, and they think that testosterone will just be the thing. So we need to set realistic expectations, and then we need to talk about that we don't need to be perfect all the time.
Michael, thank you so much for having a conversation that we both know is needed, and more of it is needed for sure. So I appreciate you you coming on and sharing your words of wisdom. If people have liked what they've heard and they want to know more, where is the best place to find you? And I will leave the final thoughts with yourself.
It would be on LinkedIn. Just search for the penis guy, or Instagram, search for the penis guy, Michael Strøm. Then you're gonna find me. The final note for me, just believe in yourself. Look yourself in the mirror and say, I'm a fucking beast. I can do this. And then you're gonna be the guy everyone is aspiring to be. Thank you for having me.